Hi everyone, welcome back to our channel. Today, we will talk about on a topic that might be quite familiar to many of us, heel pain. First of all, we should know about what is heel pain and what are their causes. Heel pain is an extremely common complaint with several common causes. It is important to make correct diagnosis of the cause of the heel pain, so that appropriate treatment can be given to the patient. Common causes includes plantar fasciitis, Baxter's nerve compression, fat pad arthropathy, Achilles tendinitis, Haglund's deformity, stress fracture of the calcaneus, tarsal tunnel syndrome, lumbosacral spine radiculopathy, L5S1, plantar fasciitis. The most common cause is plantar fasciitis. Plantar fasciitis is the irritation and swelling of the thick tissue on the bottom of the foot. This fascia can become inflamed and painful and making walking more difficult. Plantar fasciitis is most severe in the morning. The startup pain symptoms are more severe for the first out and persist with activity through the day. Pain symptoms will intensify with prolonged exercise or standing. There will be tenderness over the plantar medial heel with negative tinal sign. X-ray may show a plantar heel spur. Plantar fasciitis is usually associated with a tight heel cord. Baxter's nerve. The Baxter's nerve is the first branch of the lateral plantar nerve. The Baxter's nerve contributes to 20% of all heel pain cases in this nerve, and it provides motor innervation to the abductor digiti minimi muscle. The nerve courses vertically between the abductor hallucis and the quadratus plantae muscles, then makes a 90-degree horizontal turn, coursing laterally beneath the calcaneus to innervate the abductor digiti minimi muscle. Involvement of the Baxter's nerve may affect running athletes, causing pain on the medial plantar aspect of the foot. Entrapment of the Baxter's nerve is usually overlooked or misdiagnosed. Fat pad atrophy. In fat pad atrophy, the cushioning fat pad around the calcaneus thins, leading to a loss of cushion and significant walking pain, often prevalent among the elderly. The common use of steroid injections for treating plantar fasciitis is associated with a history leading to heel pad atrophy, presenting an unintended consequence in some cases. Patient will have pain when walking. The pain is deep, central, non-radiating plantar heel pain that is worsened when the patient is barefoot and resolves when the patient walks on her toes, with tenderness at the central aspect of the heel pad. Achilles tendinitis. The patient will have ankle pain for several months, chronic condition. The patient will complain of pain and swelling because the tendon is thickened with tenderness to palpation about the top of the calcaneus. Haglund's syndrome. The Haglund's deformity is an insertional calcification and exostosis at the insertion of the Achilles tendon. The patient is usually treated by physical therapy and non-inflammatory medication. If the symptoms persist beyond 6 months, then surgery may be needed, with excision of the Haglund's exostosis and insertional calcification. If more than 50% of the Achilles tendon is detached to remove the posterior superior calcaneus prominence, and the tendon becomes weak, and should be secured to the bone of the calcaneus with suture anchors, or tendon transfer to bridge the gap. Stress fracture of the calcaneus bone. The stress fractures of the calcaneus can occur due to overuse injuries. The patient will complain of heel pain. Severe weight-bearing pain in the patient increases with walking and running. The pain associated with the calcaneal stress fracture does not improve throughout the day, and each step is painful. X-ray can be normal. We may need to get an MRI to diagnose the stress fracture of the calcaneus. Tarsal tunnel syndrome. Paresthesia and numbness in the plantar foot. Symptoms are worse with activity and the paresthesia may wake the patient up at night. Ganglion cyst of the ankle, known cause of tarsal tunnel syndrome. Lumbosacral spine radiculopathy. Pain on the lateral side of the foot can result from L5-S1 herniated disc, will cause radiculopathy. The S1 nerve root supplies the lateral aspect of the foot. Pain on the lateral side of the foot can result from L5-S1 herniated disc. As we conclude our exploration into the intricacies of heel pain and its diverse causes, remember that understanding your feet is the first step towards relief. If you find this video helpful, then please don't forget to subscribe the channel and hit the like button and stay tuned for more updates.